So what is major depressive disorder? And more specifically, what exactly is a major depressive episode? Major depressive episodes have to occur in both major depressive disorder and bipolar disorder in order to receive the diagnosis. So it's important to understand specifically what is clinically, what do physicians consider to be a major depressive episode? And that's what we're going to talk about right now. So a major depressive episode is a specific circumscribed period of time in which there is a change in affect, how the person appears, a change in mood, and neurovegetative signs, which we'll talk about in a minute. In order to meet criteria for major depressive disorder, the major depressive episode needs to last at least 2 weeks. It can be single or it can be recurrent, and it needs to be interspersed with periods of normal mood. There are more chronic forms of depression, such as dysthymic disorder, but we're not going to talk about those in this video. So what are the specific diagnostic criteria for major depressive disorder according to the DSM-5-TR? That's the Diagnostic and Statistical Manual 5 text revision. According to the DSM, you need to have at least 5 of the following criteria in order to receive the diagnosis of major depressive disorder. One of the symptoms has to be either number 1 or number 2. So what are these criteria? Number 1, depressed mood. The depressed mood has to be most of the day, most days, for a certain period of time. In major depressive disorder, that period of time is 2 weeks. Number 2 is something we call anhedonia, which is a markedly diminished interest in activities or diminished ability to experience pleasure from previously pleasurable activities. Number 3, significant weight loss or weight gain. Typically, this is on the order of at least 3 to 5% of body weight in the course of a given month. Number 4 is insomnia or hypersomnia nearly every day during the time of the depression. Next is psychomotor retardation or agitation, and this typically is a speeding up physically, moving around a lot, or slowing down to the point of possibly just not moving at all. Often this is observable by outside people, other people, but the person themselves may or may not experience an internal sense of agitation or of being slowed down. Number 6 is fatigue every day or nearly every day. Number 7 is feelings of inappropriate guilt, worthlessness, feeling very bad about oneself and kind of ruminating on those thoughts. Number 8 is cognitive impairment. So typically that's a diminished ability to focus, to concentrate, to follow through. Most of the time people will be subjectively aware that this is happening and feel very frustrated about it. Lastly, recurrent thoughts of death, not necessarily limited to a fear of dying, but suicidal thinking, suicidal thoughts or intent, or just ruminating on the concept of death in general. So again, you have to have 5 of these criteria, and at least 1 needs to be the first or the second one: depressed mood or diminished interest in activities and diminished ability to experience pleasure from activities. So once this has been established, what else? There has to be a loss of function that is caused by these symptoms and criteria. And loss of function would mean at work, with family, socially, somehow there has to be a significant loss of one's ability to function in the world. Next, the episode cannot be better attributed to drugs or medications or medical problems. So there are plenty of medicines out there, I won't give a full list here, that can biologically lead to a depressive state. If that's the case, that's not technically major depressive disorder. In addition, the depressive state cannot be better explained by another psychiatric diagnosis. So, for example, people can have a diagnosis of schizoaffective disorder that includes depression. If that's the case, then they do not have major depressive disorder. That gets a little technical and probably less important to most people. Lastly, and very important, for a diagnosis of major depressive disorder, there can never have been either a manic episode or a hypomanic episode. For more information on specifically what constitutes a manic episode, please see my video here on mania, where I describe in detail what criteria need to be met and what symptoms have to occur in order for someone to be considered having had a manic episode. In order to have a diagnosis of major depressive disorder, there can never have been mania or hypomania. So those are the technical criteria, but what does major depression look like clinically? What does it actually feel like and what do we see? Well, first thing is generally there is this diminished mood, a sense of being blue, being down in the dumps, being generally unhappy and being unable to kind of crawl out of it of our own accord. People will often talk about feeling bored or disinterested. Maybe they used to go skiing or they used to go fishing, and now those activities, either they do them and they don't bring pleasure, or they decide not to do them anymore because they can't imagine that they're going to feel any better when they do them. There's often social withdrawal, social isolation, an inability or an unwillingness to interact with others. Many people feel very fatigued, very tired. They either want to sleep all the time or they feel they cannot sleep at all in spite of being exhausted. They may feel slowed down as if they're walking through wet cement or underwater. It's very difficult to move. It's very difficult to get out of bed. People who are depressed may actually appear normal to those on the outside. So they may go to work, interact with their family, and appear to be normal. But when interviewed, patients with depression will almost invariably say that that takes an enormous amount of effort and is exhausting to sort of wear that mask all day long. Appetite and sleep may change, so oftentimes people will describe an inability to eat, an inability to enjoy food, and they have to force themselves to eat. Alternatively, they may eat a lot more than normal. They may eat a lot of carbohydrates in an attempt to sort of self-medicate. There may be weight gain or weight loss associated. Sleep disturbance is very often a sort of middle of the night insomnia or an early morning or what we call terminal insomnia. So you wake up either in the middle of the night or very early in the morning, 3, 4 o'clock in the morning, and you are unable to get back to sleep. That disruption in sleep architecture is very commonly associated with depression. One of the most devastating symptoms of depression is a constant sense of worthlessness and kind of a free-floating guilt. So people will begin to blame themselves for pain they are bringing on their families, they will blame themselves for being sick. They will feel just generally like they're not worthwhile in the world, like they have nothing to contribute, and in fact are just contributing pain and misery to those around them. People will sometimes develop an exaggerated sense of responsibility for bad things that happen, regardless of the fact that they have no power to control them. So if something happens to your child or your spouse, they lose a job, or there's a tendency for depressed people to somehow blame that on themselves. In an extreme way, people can become so convinced that they are bad that they begin to take on responsibility for things like world poverty or the wars or other things that are way beyond their circle of control and power. Having a difficulty thinking, concentrating, following through, and getting things done is very common and tends to have a very negative impact on schoolwork, on performance at the job, and even on family life. People who are depressed will often say they cannot concentrate, and sometimes that is the chief complaint. The thing that brings people in for help is a total inability to concentrate, a feeling that they have a brain fog going on all the time. It's of death, suicide, dying can become so persistent that it is difficult to think about anything else during the day. Sometimes people who are very depressed will begin to plan suicide. They'll research about it. They'll look into ways they might do it. In very extreme cases, people who are depressed may lose the ability to even care for themselves. So not showering, not changing clothes, not taking care of just basic hygiene, and not caring for the environment around them. It is really important to know that people who are depressed, particularly people who are very depressed, may actually develop a difficulty in communicating their feelings because of the poor concentration, the psychomotor retardation or slowing down, the severe fatigue, and the hopelessness. They may not even be able to talk about what's going on and how they're feeling. And the diagnosis needs to be explored based on their function and how they look and what the family and loved ones are noticing is going on. So those are the basic criteria of major depressive disorder. I've listed them again here. For more information on mood disorders, please see my mood disorders playlist. And for information on mania, please see this video on mania and bipolar disorder. That's it for today. Thank you so much for watching. Remember to hit the like button and subscribe if you like this video and the notification bell so you don't miss anything. And I will see you next time.